Dental implants are titanium screws that we place into the bone to replace missing teeth. Could be many teeth, can be one, or can be the whole upper jaw, the whole lower jaw. Another options, if the patient is not a good candidate for implant for any reason, or if we have to offer to a patient a more cheap treatment, there is the bridge. Always there is the traditional porcelain bridge. I mean, if we want to put, if the patient needs one or two implants, but if the patient needs an full upper or lower, there is the traditional dentures. But there's always an option for a patient. There's always an option. Could be dental implants or traditional dentistry. If we put a dental implant, just like an example, if we want to replace just one single tooth, we have to grind the teeth. I mean, we don't have to grind the teeth if we put a dental implant. But if the patient decides to go ahead for the traditional one, we have to grind the teeth next to the gap, next to the area that we don't have a tooth. So it's better to use the implant. It's very good option because you don't grind, you don't cut a good teeth, a healthy teeth. But if the patients do not want the implant, or for some reason a medical status cannot go for a dental implant, the patient can use for sure a traditional porcelain bridge. Both are good, but we have to understand, I'm going to be really clear about that question, because we have to understand that a prosthesis sometimes is not forever, because we think the prosthesis is always forever, and we have to take very good care of the dental implant or a traditional bridge, both. If the patient takes really good care, clean, go to some sessions to every 6 months or a year, clean the area, maybe we can have an implant for 25 or 30 years. And the bridge, the traditional bridge, the life of the traditional bridge is shorter. Maybe it could be around 15 or 20 years. The all-on-4 or the all-on-6 can be, if we have some patient or some cases where the sinus is very, very low, and for some reason we cannot put a bone graft. So there is some structures on the face that always has bone. Could be just next to the nose, in this position right here, or sometimes we can put an angulated implant to go back to the areas that we have more bone and use angulated implants. All-on-4 implants is a surgery that we place the implants. It's a technique developed by Nobel Biocare, and it's been into the market maybe for around 10 years, and it's been working really, really good, because we place the implants and same day the patient can have a temporary denture. The patient can start biting the same day, and in a few days can have the final one. It's around a week. The time we place the all-on-4 implants, then we wait around a week for the laboratory to make a all-on-4 denture. The more bone that we can use bone at the, if we don't have too much bone, we use only all-on-4. But if we can put more implants, maybe more back at the zygomatic bones. The zygomatic bones are the bones around the cheeks, and if we can put more implants, better. But if we don't have too much bone, at least we have to use all-on-4.